Good afternoon. Hey. Anin, Buju, Apajikachinendam, Akanakabijayanoma. Thank you for coming here this morning. I want to first acknowledge and thank everyone for you being here. And I also want to acknowledge that we are gathered here on the unceded, unsurrendered Algonquin and Anishinaabe territory. I want to acknowledge and recognize the Minister of Indigenous Services, Patty Hajdu, for today's announcement, and I want to thank her for her unwavering commitment to work with First Nations people. I know it's not always easy, we don't always get along, but I know that we're trying our best to work on reconciliation together. These things are not always easy, and particularly when we sometimes fight about money or fight about projects or progress or other issues, but I very much appreciate the Minister for being here today and for helping the communities of Moose Cree, Fort Albany, Kashechewan, Attawapiskat, Weeneebayko. I want to congratulate them for their hard-fought efforts and their commitment to their people. And we welcome the federal government's announcement today for funding the completion of the WAHA Health Authority Hospital. This marks a significant step forward in fulfilling a long-standing commitment. However, the delay in prioritizing the health and well-being of First Nations highlights the urgent need for culturally informed care that upholds First Nations' inherent and treaty rights and our right to self-determination. I know that working together is, like on this project, it's easier when we're at the table together talking through these things, that announcements like today come to fruition, that they come together in a better way. This is I know it was a hard-fought battle this past few weeks, but I'm glad that we're here today, and I'm glad that we're here together. Moving forward, the Assembly of First Nations expects that the government to continue fulfilling its commitments to First Nations by ensuring transformative change towards First Nations-led healthcare programs and services. As this is our treaty right, and it's our right to have what other Canadians have in this country. This should include sustainable funding, increased capacity, and improved healthcare facilities that are strength-based and culturally informed. Canada's universal healthcare system is widely considered to be among the best in the world and a source of pride and health for many Canadians. However, for First Nations, we know that this is sometimes far-fetched for many in the North. Their access to a hospital is few and far between, and we have to do better. And announcements like today close those gaps. And I know that we have a huge gap in this country that we have to try and close when it comes to infrastructure, health, housing for First Nations people. And it's pleasing, and it gives us hope when we see commitments like today happen. We know that many First Nations people do not have equitable or reasonable access to healthcare services compared to the general Canadian population. And we know that many of our communities, especially northern ones, are at risk of poor quality of healthcare or have to travel great distances to receive reasonable treatment or go without. Our people continue to experience barriers to healthcare, resulting in significant and ongoing health disparities. And we have spoken to people across this country who feel like they're on our own lands because of a dire lack of adequate health services, particularly in remote communities. Many First Nations experience anti-racism in health systems, a lack of cultural safety and acceptance of Indigenous health and healing models. But I want to today lift up and congratulate the leaders of the Mushkegowuk Council, the Chiefs of Ontario, the Anishinaabe Nation, the province of Ontario, and of course the federal government for their advocacy and coming together in a good way, and their unwavering commitment to secure funds for this brand new facility. They will finally accommodate the needs of the people in this particular region who will have access to top-tier health care that every person in this country deserves. And this is what happens when we all work together. First Nations leadership, the provincial and the federal governments, this is what happens when we come together in a good way. Results like this happen today. So I want to say congratulations and Chimigwech. Thank you so much.
Well, Chimigwech to you, National Chief, and it is truly a joy to be with you here in Algonquin territory. And Obviously, I just want to acknowledge the National Chief flew in after kind of on a last-minute notice to be here, which I think indicates the importance to her and to her entire team. I do also want to thank other partners that have been at the table and working so diligently to make sure that we could see the fruition of this funding that will support the province of Ontario and their responsibility to deliver health care. So Grand Chief Alvin Fiddler, who has worked very closely with me and with WAHA and the Weeneebayko Area Health Authority, Lynn Innes, who is of course, and her whole team, who have met tirelessly with Indigenous Service Canada teams to understand the nature of the project, and of course every single person in this country who has advocated alongside of us. And I think we do see a growing expectation of Canadians that we make good on the promises made to Indigenous people, and I want to thank the advocates across the country who keep reconciliation front and center in the minds of this country. So today I'm really thrilled to announce that the federal government will support Ontario with funds to fund a new hospital build in Moosonee. This represents $1.2 billion of new investments. It's in addition to $200 million that has been invested since 2018 on various aspects of the design and planning of this project. And of course, we will make sure that while this hospital center is being built, this care center is being built, that we'll be supporting the maintenance of the current building to make sure we can stretch every ounce of life out of that building while the Weeneebayko Area Health Authority awaits its brand new center. J'annonce aujourd'hui que le gouvernement fédéral va être là avec le financement complet pour construire un nouvel hôpital à Moosonee. Ça représente 1,2 milliard de dollars en nouveaux investissements. Ça s'ajoute aux 200 millions de dollars investis depuis 2018 pour prolonger la durée de vie de l'hôpital et soutenir ces projets. Finally, I'd just like to thank all of my officials, and certainly the officials throughout the entire system, led by Prime Minister Trudeau, who felt very fervently that we needed to complete this project and honor the agreements of WAHA, which was an agreement signed between the Ontario government and the federal government for better health care in the Moosonee area, in the Weeneebayko area, in 2008. And so this is the completion of a project that has been long-standing, and I'm very thrilled to be able to commit the $1.2 billion to Ontario so they can complete the project.
How much money is available now but wasn't in the federal budget?
Well, I actually can't speak to the budgeting process, but what I can say is that officials have been meeting regularly and in an ongoing way over a number of months. I think part of the challenge is that the federal government isn't the contractor, is not the proponent, and there were many questions to the Ontario government about the nature of the money, about the nature of the payment contracts, and I think for me, we really saw a change when we were able to engage directly with the contracting company directly. So that gave, I think, the federal government the clarity on the $1.2 billion ask, and we were able to, I think, satisfy for ourselves that the payment schedule and the sufficiency was there to get the project complete.
What do you mean? There's been tremendous political pressure from First Nations leaders, from the National Chief, from the federal NDP, in order to see this money flow. So what changed?
I think what changed was our ability to work directly with the contractor.
Who are you talking about? Which contractor?
Well, so this project this size has a general contractor. In this case, the name of the contractor is Pomerleau. The federal government had not had an opportunity to actually see directly the information that it needed to ascertain that the $1.2 billion on the payment schedule that was required was in the right sufficiency or in the right timing. And so this was an ability for us to work directly with Ontario, with the contractor, to get the answers that I think provided the confidence for the officials that we were on the right track.
But politically, you tried to put the onus on Ontario to make good on seeing this project come to fruition. Now, again, things have changed, so I don't understand. Well,
I think what we see in Ontario, despite the increase of $7 billion, and the National Chief spoke about it actually in her remarks, is an ongoing discrimination in healthcare systems, not just in Ontario, but in fact across the country, which is why the federal government stepped up with the $2 billion health equity fund and has been involved in the renegotiation of the healthcare transfers. This is a very specific agreement signed by Ontario and the federal government, as I mentioned, in 2008. But when I hear comments from, for example, Minister Rickford of Ontario talking about how a hospital in Kenora can't be built because Indigenous people might be the users of that hospital. In fact, that's the kind of systemic discrimination we see.
But in this instance, the First Nations leaders.
Sorry, Olivia?
What exactly did you have to see in the contract that made the federal government come to the table? Because the hospital and First Nation leaders have been saying for years now that there's this commitment from Ontario and the federal government to split the cost. And they said that they need this money before the summer to go ahead. So what did you see in that contract that made you come to the table?
So we were at the table, and officials were working to actually get to the agreement. I think what satisfied the due diligence that finance required was seeing the actual payment schedule, seeing what the deadlines actually were, and having an ability to discuss directly with the contractor how, in fact, to flow that money in a schedule that would allow them to continue the work. Until then, we were really operating on Ontario's word.
Ontario respectfully has said that it was a lack of federal action in this case. And in fact, First Nations leaders agreed. They said that Ontario was doing what it needed to do and that the feds had failed to step up. Today, you're taking a very different position on the money. You have stepped up, but there has been a lot of suggestions that this project was thrown into chaos. And I'm wondering, as Minister, do you take responsibility for the level of anxiety that First Nations, they came to Ottawa, there were several leaders who were here, including the National Chief, almost in tears about the fact that this project was being thrown into chaos. Do you take responsibility for that?
I take responsibility for relationships with First Nations partners, and that's why I'm so pleased to have the National Chief here with me actually speaking about this agreement. I also take responsibility for the investments that the federal government makes on behalf of Canadians. And as I've said a number of times, there were questions that were unanswered by the Department of Finance, by the officials working from my department on this project. We got to those answers, and we are here today to say that we will support
Indigenous issues.
I think the reality is that when the proponent is not the federal government and the proponent is Ontario, if the sufficiency of information is in question, the federal government deserves those answers, and we have them. And today we're happy to say that we'll support the Ontario government in building the centre.
Clarify what you mean by continuing maintenance for the existing centre. Is that additional funding that's going to be going into maintaining the health centre that is available until this 1.2 uses for the new hospital?
It is, yes. So there are a number of deficiencies that are quite actually serious. For example, and I don't have all the details, but for example, there is a portion of a roof that needs to be replaced. The federal government will be paying for those repairs so that we can ensure that there will be a health centre until the new centre is built.
Can we just hear we'd like to hear from the National Chief if we can.
Yep.
Thank you.
For sure, thank you. I think when it comes to health care, I know last summer, I know that all the premiers came together and they wanted to talk about health. And I think that in this country, First Nations need to be at the table at every level. We can't be left out. And I know that there's the Council of the Federation. The premiers meet all the time. The federal government meets with them. And we're always kind of left at the kiddie table the day before. We're, okay, we come and meet for an hour and we're left out. But then the next day, this country talks about billions of dollars in healthcare transfers to provinces, and First Nations are not at those tables. And I think that that's a big problem in this country. And as we work towards reconciliation, we need to be at the table. We can't be left out of all of these negotiations. And as soon as First Nations come into this and we take control, I'm glad that people came together. And it shouldn't have to be like that. We should be at these tables ahead of time. And I think that things need to change in this country.
If that was the case, could this have been, I'm just asking the National Chief, could this have been prevented, this situation of First Nations leaders flying from their communities, talking, but calling on the federal government to make good on a promise? If you had been at the table sooner, could this have?
Absolutely, because I think there's big transfers going to provinces, and First Nations are in these provinces, and we don't even have the discussion point to even begin to negotiate that, and it's right across the country and on other pieces, but then we're kind of left out, for instance, sometimes on education, for instance. Oh, that's a federal responsibility. So we're always yin-yang back and forth. Like, this is why Jordan's principle, for instance, that's something where First Nations had to step forward and advocate to make sure that that program was front and forward, because I think when we're left out of these tables and processes ahead of time, we can avoid all of this. I think because then we would be at the table advocating and not being left out in the dark all the time. So I'm glad for today. Today's a happy day. It's a good day for First Nations people in the Moosonee area. But at the same time, it absolutely could have been prevented if the First Nations from that territory were at the table with Ontario and the federal government as they're negotiating and talking about health transfers. So thank you.
And I think that's a really important point, National Chief. I will say that I was involved with the Minister of Health and all of the trilateral conversations with First Nations people as we were renegotiating those health transfers. And in fact, Ontario didn't send political leadership. We need political leadership to drive that idea of ensuring First Nations, Indigenous voices are in the transformation of our healthcare systems. Look, I come from Thunder Bay. I know what it looks like in an emergency room. I have seen the systemic discrimination that Indigenous people face in hospitals and healthcare systems all across this country, and that's what this government's trying to do with participation and support from the AFN and many other First Nations leaders and Indigenous leaders across the country. Thank you.
Thank you.
Thank you.